I'm going to take, first of all, any other of the panelists want to comment on that? Okay. I'm going to go on to the next. I've got a question on a card which is really quick, and then we're going to go to the folks at the mics. This is from Robert. Why are we the only industrialized nation without a national health care system? Will you support a single-payer system like that proposed by Mr. Conyers? House Resolution 676. Right now, that's not an option. I know many folks think this bill goes not far enough. Some people think it goes too far. I think the goal is to strike the right balance. And right now, the Conyers bill is really not on the table. It's a concept, but it's not really what we're debating here today. So that's not really an option for us. We need to be looking at the plan that is before us.
Why not?
That does many. It's just not.
Who
It's
says
not.
it's on the table? Give us a reason, that's all.
It's just a collective. It's the collective, really, debate that is part of this ongoing health care reform. And so this has been full of debate, compromises, concessions, and trying to find a common sense middle ground that is actually achievable. So that's where we are in that process. And let's go. I'm going to take this front mic, and then we'll go to the back mic next. Yes.
Okay, thank you. Good morning, Congress.
Good morning.
First of all, let me just thank the college for hosting this, and I also happen to be a graduate of Forest Park Community College. My name is Lou Moy, and I'm president of the St. Louis chapter of the Coalition of Black Trade Unionists. And I, along with my organization, believe that health care is a human right. So that's where we are. In May of this year in Atlanta, Georgia, we had the 38th National Convention of the Coalition of Black Trade Unionists, and we had a lot of discussion and debate about health care. But the end result was that we came out in support of a single-payer system, House Bill 676, John Conyers bill, which you just mentioned. And that discussion was led and by our president, Bill Lucy, Secretary of Treasury of ASPE. But all over the country, a lot of union organizations, as well as a number of your colleagues, have signed on in support of House Bill 676. I know Congressman Clay has also. But our main support for that concept is that we believe that it would be the most cost efficient of all the plans that we've had a chance to review. And we also believe that it will provide the best quality of health care. And what I was wanting to ask was, I know I listened to a couple of President Obama's town hall meeting on health care, and the single-payer system was raised, and he said at one of them that he was open to discussion on that, and I know at one time that he was supportive of a single-payer system. So what I was wanting to ask is, and I just heard your comment that it was off the table, how can we get it back on the table? And what we can do to support that bill.
Dr. Wolf wants to make a comment about that.
I just want to make one comment before Congressman Carnahan replies. You know, ever since I've been in medical school, which is 1,000,000 years ago, I have been in favor of a single payer. But it looks to me now, especially with the, well, first of all, there was the whole thing with Hillary trying to do it, and it was too complicated, it was too much, it was too soon. And now with the economy the way it is, look at all the people who are employed in the insurance industry. And if you get a single, I mean, it'd be like a tsunami, an economic tsunami for unemployment if all those people got unemployed. And so, in my own mind, I mean,
No, that's not true.
well, in my own mind,
Let's listen
let
to
me-
her opinion,
in
okay?
my own mind, I think that the public isn't ready for this. You and I are ready for this, but most of the people are not ready for this. And if you got a public option out there, and it would be able to experiment, able to change, and very competitive, what would happen is that the other insurance companies, I think, would become more like the public option. And then very, very gradually, you could decide, again, make another decision point. Do you even need a single payer anymore now that everybody's kind of on board with doing the most efficient thing? I mean, as a physician, and a small business owner, I am killed by this healthcare system in many ways. One, I pay health insurance for my employees. Two, I don't get paid anything by the insurance company. And three, every one of our 6 physicians has 4 employees to deal with the insurance company. So we are being killed by this. We don't need this system. I mean, as physicians, it's terrible also. Plus it's demoralizing. We have responsibility, no power, and people quit the practice. They all become subspecialists because nobody gets paid to be a primary care physician. It isn't respected no matter what people say. So I think I hear what you're saying, and I would hope that people would understand that politics is the art of doing what it is that can be done, and I don't think single payer can be done.
Okay, Russ, if you could comment on how we could possibly get this.
In terms of the current debate, it would be very, very difficult, I think, to get that on the table in terms of as written by Congressman Conyers. Some of the important elements behind the Conyers bill, like having a public option, I think is a good balance. And again, talking about the art of the possible, some people said you can't let the perfect be the enemy of the possible here. And so even though some people may want to have some ultimate system of different, this has evaded us since Harry Truman and every president since. And so we have an opportunity to find out what's possible to make some really fundamental and important changes in terms of covering people, in terms of keeping their choices, in terms of cost reductions. And frankly, we can't afford to put these changes off any longer. Even if it's not exactly what everyone wants, we've got to make this important package, I believe, to try to get something actually passed this year before we get into the craziness of another election year. Otherwise,
Thank you, Russ. I've known you for a long time, and I know you have our interests at heart. Thank you.
thank you. I said I would go to the back mic after that question, so yes, ma'am. Can you pull that mic down a little bit? I think it's taller than you are.
Good morning, Congressman, and generally I don't need a mic.
We can all hear you. Thank you.
My name is Alicia Green, and for 20 years I walked the streets of advocacy as the people's advocate, but today I came to speak not for myself, because I've got 6 ailments, and medical science is about to give up on me. And last night I discovered lumps in my breast, so I'm not here for myself. I done gave up like medical science has given up on me. I'm here to speak for the poor who will attempt to transition from dependency to, oh God help us, that word, self-sufficiency. You see, because there was a time when I was an able-bodied human being. I lost my mind, and then I started losing my body. Why? Because in the transition from dependency to self-sufficiency, I lost my health care.